Good afternoon. I'm Dave Roth. Welcome to the 2020 Summit on Serving Immigrants and Refugees in Times of Uncertainty. DuPage Federation on Human Services Reform. We're your hosts today, and we are a planning council for human services. We have special capacities for language access, public benefits access, and data analysis. And we thank you for participating today. Together, we are working to integrate refugees and immigrants into economic mobility, civic engagement, and full equity. This afternoon, you will hear from 6 leaders from government and community. You will hear about new difficulties, proven services, and new possibilities. Our hope is that as a result of this program, you will leave with new ideas and stronger hopefulness. As I listen to these 6 leaders, I'm going to be listening for ideas that can unify us. And I invite you to join me as you're listening. And the 3 things that I'm listening for through these 6 presentations follow 3 questions. What do we believe? What do we expect? And what will we do toward this end? And I invite you to join me as we listen in today. Now it's my pleasure to introduce our very first speaker. I'm very happy to introduce Grace Ho, Secretary of the Illinois Department of Human Services. Your summit materials provide a nice biography of Secretary Ho's accomplishments as an advocate for immigrants' rights with the Chinese Mutual Aid Association, Woods Fund Chicago, and Illinois Department of Human Services. At DuPage Federation, we have deep appreciation for Grace. My predecessor, Candace King, describes Grace as a godmother of our language access advocacy. That story is that in 2002, Grace joined with Alice Cottingham and provoked a discussion in the western suburbs about language barriers faced by immigrants and refugees. A collaboration was created, the need for qualified interpreters was identified, and our Language Access Resource Center was established.
Yes, I can't even remember how long ago that was when I was the director of Chinese Mutual Aid Association, and we'd opened up an office in Westmont, Illinois, where that little Chinese supermarket is. We had a 1-room office, and we were working with a lot of older adults who didn't speak English, and I reached out to Community Memorial Foundation. It was Jim Durkin at the time, and asked him, you know, who he could connect me with in the western suburbs. I mean, interestingly enough, I kind of grew up in the western suburbs. I grew up in the Grange. I live there now. I went to Lyons Township High School, my kids, etc. But I didn't really, I had never really worked in the western suburbs. So it was a great opportunity to kind of be in my backyard and also be connected with the rich array of community services in the western suburbs. And, you know, Candace and I were co-conspirators, I would say. And, you know, I even began serving on the board for a time until I, you know, stepped into the role of assistant secretary at the Illinois Department of Human Services. And so I had to resign from the DuPage Federation board. So there's a long history, and I have a deep affection for the DuPage Federation. And I think the last time that I think I saw Candace and members of the DuPage Federation team was at your ribbon cutting a few years ago in your new offices, and I had the opportunity to hear Secretary Demas kind of give his words of remarks too. So, you know, a lot has happened, and it's a pleasure for me to be here with all of you, to be with my old friends at the DuPage Federation and to join this Immigrant Integration Summit. You know, it's an understatement to say that we live in challenging times. And I think certainly serving, working with immigrants and refugees is especially so, because a lot of the provisions on the federal standpoint that really leave this community behind. And I think us at the department, the governor's office, with all of you, I know that we are doing all that we can to support these families across the state. But I want to thank you, Dave, and our other presenters today who helped put this important and relevant event together. I know that later this afternoon, you're going to be hearing from Deputy Governor Flores, who's really been an amazing leader and who's given us space, inspiration, and support to do a lot of the things that we've done over the past year and a half, and also to really respond quickly and decisively to keep people safe during COVID-19. I also want to thank all the summited attendees for taking time to listen and learn about how we can reach the immigrant refugee communities and find opportunities they need and deserve. So I think many of you know I joined the department in March of 2019. So I'm grateful that I had about a year under my belt before the pandemic hit Illinois. And that first year was spent reconstructing the agency, which was really left in a weakened condition. I served as Assistant Secretary at the department for almost 10 years. I left to work in philanthropy. And I think when I came back, I would say, and I think that most of you felt it as well, that the agency that I'd left 7 years previous would no longer really existed. We had federal corrective action plans, looming penalties for backlogs and delays, under enrollment, underutilization. And in that first year, I'm grateful that I've been able to build an amazing leadership team and a diverse leadership team, and we've begun to reconstruct and earn the trust that had been lost between us and our primary stakeholders, providers, families, staff, partners, and legislators. And I feel really thankful and grateful that we had that first year to strengthen our system, because little did we know that we would be in the fight of our lives with the coming virus. The COVID-19 pandemic forced us to change everything we do within a matter of weeks. Things that we could never have dreamed of doing in dozens of years happened. We entered into a new gateway of reality over the past several months, and we are again at another crossroads and another gate, as we find ourselves in the next phase of a pandemic and also in deep and anguishing civil unrest that has been sparked nationally by, the police killing of George Floyd. So, we at the department, and probably along with you, we're questioning what safety means, as we have learned that it is a luxury, unattainable for many, and a privilege for many of us, that we just assume that we can be safe. And I think the virus that is COVID-19 and the virus of inequities have borne this out literally in lives lost. Who is allowed to shelter in place? Who can work from home? Who has the technology for their children to learn? Who is able to help their children with their studies? And then who must go to work without PPE, put them in harm's way because they're essential to the safety of others? So as Illinois enters phase 4 of the pandemic, we are now at this next gate. And I think a piece that the author and writer Arundhati Roy wrote about the pandemic just a few months ago is very telling. And it doesn't take a stretch to apply what she says to the necessary changes we need to make in our country for also the pursuit of racial equity. Bear with me, it's a long passage, but I think it's very relevant. Whatever it is, coronavirus has made the mighty meal and brought the world to a halt like nothing else could. Our minds are still racing back and forth, longing for a return to normality, trying to stitch our future to our past and refusing to acknowledge the rupture. But the rupture exists, and in the midst of this terrible despair, it offers us a chance to rethink the doomsday machine we have built for ourselves. Nothing could be worse than a return to normality. Historically, pandemics have forced humans to break with the past and imagine their world anew, and this is no different. It is a portal, a gateway between one world and the next, and we can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data banks and dead ideas, and our dead rivers and smoky skies behind us. Or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it. I have to tell you that we have been building a new world over the past several weeks and months. And I'm ready to fight with you and to work with you to find a new reality, a better reality for every person in Illinois. And I believe in the leadership of our governor, our sister agencies, and the team at DHS to do the hard and the right thing. And I think it's important to share, as we think about the future, the road that we have traveled since early March. And it has a lot of relevance to where we're headed and to immigrants, refugees, and what we've done to support them. So the recent months of the COVID-19 pandemic and the weeks of social unrest have amplified inequities in our state and across the country. You know, I want DHS to be a place of comfort, for healing, and for hope. And most importantly, DHS must be here for those who need us most. We have been vigilant about ensuring the safety of our staff, partner organizations, and those we serve. And one of the values that DHS always strives for and drives towards is equity. This means that we hold ourselves accountable to providing relief and assistance to those who are in the greatest need and who have been marginalized from resources and opportunities. And this has been true of our COVID-19 response. Additional resources, funding, attention have been provided to protect and support immigrant and refugee families, people who experience or are at risk of homelessness, opportunity youth, victims of domestic violence, and people with disabilities. We at the Department of Human Services are 13,000 people strong, and we ensure that Illinois residents have the basics: shelter, food, employment, safety, and access to medical care. We have 7 psychiatric hospitals, 7 developmental centers, 4 schools, and over 120 local offices to provide emergency nutrition, medical, cash relief, and rehab services. We also fund over 500 community organizations across the state in every county to help achieve our mission. The crisis for DHS, for all of you, I know, has changed the location of some of our workforce and our physical footprint, but it has not changed the depth of our responsibility. And I think in many ways it had increased the need for our services. Our employees, your employees, are partners on the front lines of the COVID-19 battle. We've adapted our services to serve customers as safely as possible, and in most cases doing that remotely so they can access services they need from home so we can work to flatten the curve. We have transitioned to make all of our public benefit services available online or by phone, and in some cases in person without interruption, which is miraculous. We closed all of our public-facing local offices and not only continue to meet the needs of the hungry, the disabled, the poor, we met the needs of the newly employed, the newly food insecure, and housing unstable, and we did it because we did not give ourselves a choice. In March, I was sitting with the Assistant Secretary for Programs. We were still in our offices, and we were sketching out on my whiteboard what the condensed leadership structure would look like for our response to COVID-19. And then I also wrote next to that org chart, if it is impossible, we have to do it. And I believe we've done it. We've done the impossible. Our residential facilities took extra measures to protect residents and staff. We applied for every waiver we could from the federal government so that we could ease bureaucracy for those that we serve. And yet we know that this is not enough, and we are now in a different phase of the pandemic. Earlier this month, the governor announced a $600 million poverty alleviation campaign, of which almost $33 million DHS has committed to immediately mitigate poverty and respond to the needs of hard-hit communities in Illinois. The program will support more than 73,000 people across the state by serving communities disproportionately affected by the pandemic and the civil unrest, including many of our immigrant families. The actions began this month and will extend throughout the summer. Our strategies will include stipends for under and unemployed youth to help rebuild businesses, a summer youth program to empower and engage young people and help to rebuild communities, increased capacity to support food banks to feed hungry families in the hardest hit areas, an effort to increase the availability of fresh food and produce while also supporting Black and brown farmers, increased demand, increased services for mental health services, and to equip them to better serve diverse communities. We are going to be launching in the coming weeks an effort to provide small grants for community organizations across the state to engage in healing circles, restorative justice circles, and other healing activities to begin to digest all that has happened to us over the past weeks and months. And then also, finally, we're in the process of actually deploying one-time $500 payments to all of our TANF family members, $500 in addition to their monthly grant to ensure economic and food security. We are also proud to have partnered with the Illinois Immigration Funders Collaborative, also known as IFC, to support the COVID-19 Immigrant Family Support Project. We dedicated in fiscal year 20, $2 million in pandemic-related emergency assistance funding to Illinois residents, regardless of immigration status, who are facing unemployment, loss of income, medical costs, and food and housing insecurity as a direct result of COVID-19, and are ineligible for any federal funding relief. That includes the stimulus payment as well as unemployment. While many Illinoisans have access to support from the Federal CARES Act and to other state and federal benefits, we know that many immigrants were excluded purposely, many of whom work in industries that have been dramatically affected by COVID-19. And this project helped fill a very large gap and provide much needed direct support for immigrant families. And I think the really tragic part of it, but that ends with positive news, is that funding was depleted in less than 24 hours. We had almost 2,000 applications accepted and are still reviewing hundreds more. On average, the average household applying has 4 people and an average household income of over $18,000. And over 88% of applicants were uninsured. This shows the vast need for these services. Majority of applicants are Latinx or Hispanic and female, and most have lost their jobs or had loss of hours. Food, rent, and utilities make up their greatest needs for our applicants. The good news is that the COVID-19 Immigrant Family Support Project is going to be a part of our fiscal year 21 plans. As many of you know, we received significant appropriations in the form of federal funding as well as general revenue funding to continue to support our welcoming centers, the immigrant services line item, as well as this critical family support project that's meeting the needs of so many immigrant families across the state. Welcoming centers are a great doorway to DHS services. And there's a lot of information that you can find in our newly revamped website, which is also one of the miracles that we've been able to launch over the past many months. So if you've ever visited our old website, I invite you heartily to come visit our new website, and you will see a day and night improvement. You know, we understand people are hurting right now, and we know this funding that I shared with you didn't cover all of the needs of immigrant and refugee families, but we are really excited about the opportunity to continue this effort in fiscal year 21 with many of you. I think it's important to talk about right now at this time, you know, about our mental health efforts. We are investing in new ways to ensure that our system is effectively meeting community needs. During the pandemic, we increased funding to crisis support services, enabled flexibility in care, and are now planning to execute strategies to push our systems to serve better and to reflect Illinois communities. We have to destigmatize mental health. We want to make mental health accessible in all communities and want to grow a diverse peer leadership community of recovery specialists. And we want to hear from people who have lived experience and who feel marginalized from our system in order for them to help us make it better. We can't just build it and people will come. We need to build it together, and we need to build it for people. Those are not just words on a page. Those are just words on a page unless we can make it happen. And you know, as we've approached COVID-19, if it's impossible, we need to do it. And that is why we are here. Because we are very dissatisfied with the status quo, because we know that it has left too many people out for too many years. And so as DHS looks into the future, I don't want to go back to normal, because it was not a normal that worked for everyone. Our forward-moving framework builds upon Governor Pritzker's Restore Illinois plan, Reinvent DHS. We want to use this time to inspire new thinking and to create the best, and to retain the best lessons and practices from the COVID-19 experience, and to create a stronger human services system for the future, similar to what the DuPage Federation does. You know, we acknowledge that our own operations have been forever transformed by our response to this crisis. We will provide reinvention payments for our providers to redesign and rethink their service delivery systems, and we challenge ourselves to create a more modern system. And so in closing, you know, I repeat, Miss Roy's words again, in the midst of this terrible despair, it offers us a chance to rethink the doomsday machine we have built for ourselves. Nothing could be worse than a return to normality. Historically, pandemics have forced humans to break with the past and imagine their world anew, and this one is no different. It is a portal, a gateway between one world and the next, and I really look forward to working with you all to not only imagine it, but to build it. Thank you.
Thank you so much, Secretary Ho. I know I speak for everyone at the DuPage Federation and a number of partner organizations that we so appreciate your leadership at DHS, and we're very grateful that you could join us for this year's summit.
Thanks, Kristen.